The purpose of this video is to show the anatomy of the cerebrovascular circle or circle of Willis. It begins actually in two places. One is via the internal carotid arteries, and the internal carotid arteries are shown as number 7 and 6 in the illustration, and these arteries have been cut, so the cut ends of the internal carotid arteries are shown. The other route for blood flow to the brain is through the vertebral arteries, and the vertebral arteries are illustrated here as 1 and 2. The vertebral arteries are branches off of the subclavian arteries. So the right and left vertebral arteries branch off of the right and left subclavian arteries respectively. And in our image here, this is going to be anterior. And then opposite that is going to be down here, posterior. So if we're looking at the base of the brain, the left is going to be on the right side, and the right is going to be on the right side. So we have a left vertebral artery, number 1, a right vertebral artery, number 2. These pass through the transverse foramen of the cervical vertebra, 1 through 6. And so the 7th cervical vertebra has a foramen, transverse foramen as well, but the vertebral arteries do not typically pass through that. The vertebral arteries then come together, they converge onto a single artery, number 3, which is the basilar artery. And then the basilar artery is going to branch into the posterior communicating arteries. So 5 and 4 are the posterior communicating arteries. And notice that the posterior communicating arteries continue around, and they join the internal carotid artery. The left and right internal carotid arteries join the posterior communicating arteries. An artery comes off the circle to supply the brain with blood, and 8 and 9 are the middle cerebral arteries. These are commonly affected in patients who have stroke. Number 10, right here, this small part of the circle that completes the circle is the anterior communicating artery, and then branching off and going anteriorly are the anterior cerebral arteries.